Hi, everybody. This is Dr. Badawi with Westlake Dental Care and Commander Doctors Facebook group. I am happy to introduce the tall, dark, and handsome Dr. Mees from Palmer Care Sterling. He's a chiropractor. He's going to talk to us today about what does chiropractor medicine mean and how it relates to us as dentists. Dr. Mees?
Hello, everyone. I'm Dr. Mees. My full name is Dr. Misag Shahidian, but all my friends call me Dr. Mees, so go ahead. So a little bit about me. I'm from this area. I'm a local boy from Reston, Virginia, and went to South Lakes High School, went to George Mason for undergrad, and then went out to Oregon to get my master's and my doctorate. But I love this area. I love Northern Virginia. So I came back here. I'm a partner with my best friends, Corey Malnikoff, who's a genius doctor. And we're here at Palmer Care Sterling, which is our first clinic, and now we're at 12 clinics within the DMV area. We're blessed to be serving the community as much as we do. But for those who don't know what chiropractic is, it's a very awesome, simple concept. It's very similar, I guess, to orthodontics. Like as teeth, as you know, are misaligned, right? So your spine can have misalignments. And if your spine has misalignments, the vertebral vertebrae are compressing and pinching on nerves. And if that happens, then there's nerve interference. And over time, there's symptoms like aches, pains, and other things. That's when people usually come in to see us. And what chiropractors do is that we align the spine, taking pressure off the nerves by making sure the vertebra is in proper alignment, so that nerve can exit and flow and function the way it's supposed to do. That's a little bit about chiropractic and me.
Okay, great. So what can we do as dentists to avoid this misalignment?
So dentists, it's funny because I have a lot of you guys as patients. Most dentists don't realize that your job actually is very physical. You think because you're a doctor and you're seated that it's not physical. You actually do physical labor. And I don't know. First off, you have to understand and realize that. There's a little difference between my dentists, endodontists, and oral surgeons because some stand, some sit. But for dentists in particular, you guys are seated and you're really focused on a very precise precision area of the mouth. So you're always in the same posture. All of you guys are always in the same posture, and you hold that posture for a long period of time. And just like when you go work out a muscle, the muscle adapts. When your spine's in one position for a long time, your spine adapts and it stays in that position. And when it stays in that curved position, again, your vertebrae are no longer in alignment and it's compressing on multiple nerves. So 90% of my dentists and surgeons, when they come in, they're always coming in stuck like this, like you, no offense. I can tell you right away, this guy does something in dentistry because of the findings of what the symptoms and that the patient comes in with. But you first and foremost, you guys have to know that you guys do a physical labor intensive career. That's the first and foremost. You have to understand that. The bad thing about that, doc, is that nothing you can do about it. You have to. Your job entails you being in that position, right? I have doctors. I've especially in my own building here. I have many dentists here, and some of them are, hey, let's keep me aligned until I retire, so I can do what I want to do and I can function how I want to function, because they know in order to serve their patients the way they do, they have to keep their body in that position.
Right, right. So you're saying there's a difference between standing and sitting? Which is
Yes.
better?
I prefer standing. So when you stand, the way that gravity obviously dissipates from your head all the way down to your feet. When you're sitting, you're already compressing your spine as it is. So your spine's already in compression, right? And then, moreover, usually my oral surgeons, they stand. Some of my endodontists stand, some sit. But whenever you stand, at least you have dissipation of gravity force. But you all have the same neck. You all have the very same. No matter what, you're always favoring one side, and you're always favoring that side that you are more dominant in. And your spine's always rotated and laterally flex that side, and eventually it's going to compress on those nerves, especially have appointments that last hours at a time of one real precise precision area. So yes, I would say standing's better, but it's the same vertebral, cervical vertebral findings for me.
How would I know as a dentist or a dental assistant or a hygienist that I need chiropractor work, that I need alignment?
Good.
And how could it progress from normal to needing surgical intervention?
Question. Majority of the dentists I see, or people I see, they come in when they feel pain. Of course, I want to avoid that, right? So the biggest thing is the human body, as same thing in dentistry, your human body is supposed to be symmetrical, right? Your left and your right is supposed to be the same. You're supposed to have a nice even posture. If you notice you're leaning to one side, if you're dominant on one side, and you see a little curvature in your spine, just know your spine is in proper alignment. Majority of people wait until they have a symptom, but if you easy thing you can do at home is put your ear to your left shoulder, ear to the right shoulder. They should be equal. All right, most of you guys, no offense, are not, because you're stuck in this position for a long period of time. But majority of dentists and endodontists and surgeons and everyone in the industry, the I see, wait until there is a symptom, numbness in the hands, or things that prevent them they can't do their job properly until they actually come into a chiropractor. But that being said, you guys have the best marketing campaign when it comes to wellness care. You tell your patients to brush at least twice a day.
Yeah.
Go to the dentist at least twice a year. You don't brush your teeth only when your teeth hurt, right?
Right, right.
The maintenance, yeah, your spinal health is the same way, right? I don't want to wait till you get to your pain for you to come see a chiropractor, right? You should go there to, again, a maintenance level to see, first off, if you need it, right? That's the first and foremost thing. And the doctor will tell you what they recommend for a treatment plan, like I did with you, Doc. And it's case by case, just like in your field. So I can't tell you with crystal ball when people need to come in. It's usually when there's a sign or symptom.
Right, right. But the problem with that is, like, for me, I came when I was in a lot of pain, and some people don't feel pain as much. That the pain tolerance between people is different. And I was just on the verge of having fusion.
Correct. Okay, good point there. Forgot to mention that. So every vertebra, for people that know spinal world, there's a bone and then there's a disc underneath it, and there's a bone and down throughout your whole spine. When you wait for things to get so bad, and some people have a high tolerance of pain, the bone and the two bones actually start to get closer and closer together. And if the bones fuse and the disc wears, and if a bone fuses, that's when chiropractors can't do anything for that. That's when surgery is the only option. Every month I gotta sit down and tell somebody it's too late to see me, which is very sad. Especially if it's a dentist, that's even more sad, because that tells that nerve that exits that location is being compressed to a point where surgery is the only option, and they're going to be out of commission for a while. That's why I tell everyone that the best thing you can do, the three things that you always need to focus on, is your physical health, your chemical health, and of course, emotional, mental health. The human body is designed to move. Your spine is designed to move. If you sit and work all day, like most of you guys do, and don't take care of your bodies, your spine will degenerate, right?
Right.
If you don't put the right things into your body, your wrong chemicals into your body will degenerate, right? And if you're stressed out of your mind all the time, like you're a type A personality like me, and you don't do things to reverse that type of stress into your body will degenerate. Right. So you got to take care of your body. If you take care of your teeth, you got to take care of your body as a whole. But yes, it's people that wait for symptoms usually have issues, been there for a longer time. Pain's the last thing to come on. So as soon as you feel pain, that's been there for a while. It's finally your brain saying, ow, alert, alerts, alarm, right? So I recommend everyone go to your local chiropractor, and they'll do hopefully do extensive examination like I did with you. I do imaging almost all my patients, because even though I can feel with you, Doc, I can feel and I saw how you were. Visually, I can't tell your bone health and your disc levels. So that's why I took images of all my new patients to visually see where you're at and the complexity of how much you do or don't need.
It's like we do. We always take x-rays on a new patient, a full series of x-rays, right, to see every single tooth, make sure the health is good and no symptoms. And we couple that with the clinical exam like you do, and figure it out. Okay, great. So keep moving. Yeah. Stand up when you're working.
And I want to say, you guys, again, dentists, you guys have the best marketing campaign, again, for wellness care. right? And that's what I'm trying to teach patients to do in all aspects, not just your teeth, not just your oral health, but your, every year go to your annual physical, right? Uh, just your spine, go to your chiropractor. Just make sure you take care of your health. But I love the dentist marketing campaign of wellness care. It's because even without symptoms, you take care of your teeth, right?
Absolutely.
You should do the same thing with your overall health. You shouldn't wait for symptoms to take care of your health. You should make sure you take care of your health on a daily basis, just like you do for your teeth, you do for the rest of your body. Now, movement, the human body is designed to move. Like, we're not designed to sit and work on teeth all day, right? We're designed to move. So whenever you do whatever job you do, and 90% of Northern Virginia jobs is sitting at a computer all day, make sure when you're not working, you're combating all those hours of immobility and compression. That's why it's so important to be physical, to move, do what you're designed to do. So yeah.
So if you're sitting down all day for work on a computer or on a patient, when you're off, don't go sit on the couch and watch TV. Just move.
Yeah, I mean, as a mayor, I don't know. Me and you were from different areas. Of Americans is very stagnant. I've noticed this. They wake up. Pre-COVID, you'd sit in a car for hours and hours to drive to work, and then you sit at work and work on computer all day. And then you get back in your car and spend hours drive home. And when you get home, you sit around watching The Bachelor or something. It's a very stagnant lifestyle in America, and that's why. America, when it comes to health, we're on the bottom tier when it comes to health, even though we have all these availability of all the healthcare system. We are very stagnant as a nation. So my goal, of course, is to change that. I love patients. I love seeing patients, but I love when they don't need me, right? I love fixing them when they don't need me. I'm sure you're the same way, Doc.
Exactly. Exactly. That's what I tell my patients. If I would rather not see you only for maintenance and not have to treat problems, because that means you're healthier. That means I succeeded at educating you and maintaining you in health. So we have people listening to us and watching us from all over the US. Is there a website that you would recommend to find a good local chiropractor to get an evaluation or to learn more?
Honestly, yeah. So, selfishly, we're Palmer Care. Selfishly, we're expanding. We have
Oh,
clinics
please.
now in Atlanta, in Texas, and in Buffalo, New York, and Colorado. So we're expanding. I'm biased because Palmer Care docs, we're very meticulous. We're all trained to be a high standard. That being said, wherever you are, I guess you can Google, you can do whatever you want, but I do believe I'm a very old school chiropractor. I'm a hands-on adjusting chiropractor, but chiropractors, the ones that actually take time to sit down, just like dentists, take time to sit down and evaluate where you're at right now and what you need when it comes to care is the chiropractor I feel like you should go to. All of us were here to help serve, and in the medical field, we want to make sure health is the forefront of our minds. But doctors I recommend are ones that sit down and evaluate each patient case by case to see where they're at and what the next step should be. So no, I don't have for all over the world, I don't have a recommendation on where to go. The local chiropractor is great. It's in the dentistry. But I personally, when I prefer my family or my friends, I prefer a doctor that would sit down and evaluate a case by case patient evaluation.
Just take the time. The patient's not just a number. They're taking the time to sit with them, understand. And that's why I'm talking to you now, because I was impressed with the level of care I got at Palmer Care. And I'm happy. My neck feels much better now.
I'm glad.
My posture is better. So, well, thank you, Dr. Mees. I appreciate you talking to me today.
It was a pleasure, and thank you for asking me. It's always a pleasure talking to anybody in the health field, especially someone that takes the time out to do this, and it shows that you care.
I do care. I do care. I want to raise awareness, actually.
And the same thing, if you go to any doctor, I got doctors like you that care and are passionate about what they do, because that means your name goes on a case, right? And your name is everything. You want to make sure your patient is taken care of. So I appreciate you taking time out and asking me to be here, and I'm glad to join.
Absolutely. Absolutely. Thank you, Dr. Mees.
Enjoy.
Have a good day. Thank you.